Have you ever wondered what happens to your body when you take your health into your own hands, especially as you get older? You've probably heard some people say, it's all downhill after 50 when it comes to certain things, especially in the bedroom. But here's a surprising fact. Ejaculating every day after 50 could actually have some significant health benefits, if done right. That's right, daily ejaculation might not be the health concern you think it is. But what happens if you make it a habit? Could there be both positives and drawbacks that most guys aren't talking about? In today's video, we're diving into the science behind this, unpacking the potential effects, and talking about what men over 50 need to know when it comes to ejaculation and overall health. If you're new here, make sure to hit that subscribe button so you don't miss out on expert insights for your health and wellness. Ejaculation and sexual health are often topics that men shy away from discussing, especially as they get older. But here's the thing. As men age, their bodies go through a variety of changes, and so do their sexual health needs. Men in their 50s and beyond face unique challenges, whether it's about maintaining energy, battling fatigue, or simply staying in the game in the bedroom. The idea of ejaculation every day after 50 might sound like something out of a tabloid or a piece of exaggerated advice, but there's more to it than you might think. Many men over 50 wonder if sexual activity, specifically ejaculation, has an impact on their long-term health. Whether you're trying to stay youthful, boost your energy, or simply wondering what's happening inside your body, this video will answer all the key questions and give you practical tips. Over the next 20 minutes, we'll explore the potential benefits and risks of frequent ejaculation, how it affects testosterone, sperm health, and overall well-being. By the end of this video, you'll understand whether or not ejaculating every day is something you should consider, and more importantly, whether it's a good fit for your health goals. So let's dive into the first big question. Let's kick things off with one of the most pressing concerns when it comes to male health as you get older: testosterone. Testosterone levels tend to decline naturally as men age. In fact, starting around the age of 30, men experience a gradual decrease of about 1% each year in their testosterone levels. By the time you're in your 50s, many men notice the effects of this dip: less energy, lower libido, and a decrease in muscle mass. But how does frequent ejaculation play into this? You might think that ejaculating every day would leave you drained and lower your testosterone levels, right? Well, studies show the opposite, at least to a degree. Short-term ejaculation can actually trigger a temporary spike in testosterone. One study found that after 3 days of abstinence from ejaculation, testosterone levels were at their highest. However, the difference is slight, and the spike is short-lived. So what does this mean for men over 50? Well, regular ejaculation doesn't necessarily deplete your testosterone reserves, but it's important to know that it's the consistent fluctuations in testosterone that matter. Daily ejaculation doesn't drain your supply of testosterone as much as it might feel. In fact, it can contribute to better mood regulation and maintain a baseline level of testosterone, especially if you're balancing it with a healthy lifestyle. And let's be honest, most guys over 50 feel a significant dip in their testosterone as they age. So the idea that a regular sexual activity like ejaculation could actually boost or maintain your levels, even temporarily, is an encouraging thought. Now, how about the other hormone we should all care about? Prolactin? 2. Prolactin and how it affects your recovery. Here's where things get a little more nuanced. You've probably heard of prolactin, the hormone that plays a role in sexual satisfaction and, believe it or not, in how you feel after ejaculation. When you ejaculate, your body experiences a rise in prolactin. Prolactin is responsible for the feeling of satiety or satisfaction after sexual release. High levels of prolactin can contribute to feelings of tiredness or fatigue post-ejaculation, which is why many men report feeling worn out after sexual activity. But what happens when you ejaculate too frequently? For men over 50, it's all about balance. Ejaculating every day may lead to a temporary increase in prolactin. As you get older, the body's ability to recover from higher prolactin levels diminishes, meaning you might feel more tired or sluggish if you don't manage your recovery periods effectively. The trick is listening to your body. While there's no hard rule that says don't ejaculate every day, the key is moderation. If you find that you're consistently drained after daily ejaculation, it may be a sign that your recovery time is too short. This is why it's important to pay attention to your energy levels and overall well-being. Too much of anything can become counterproductive, especially when it comes to hormones that regulate your overall health. What about the impact on sperm quality and fertility? Now, let's talk about something that a lot of men might be concerned about as they age: fertility. As men get older, sperm quality tends to decline. This decline often leads to concerns about whether frequent ejaculation could affect fertility, especially in the later years of life. Interestingly, the research is a bit mixed. Some studies suggest that frequent ejaculation might improve sperm quality by flushing out older, potentially less viable sperm. In fact, regular ejaculation can help to stimulate the production of fresh sperm. On the other hand, there's evidence showing that excessive ejaculation, meaning multiple times per day over a long period of time, might cause a temporary drop in sperm count as the body has less time to replenish the sperm pool. But for men over 50 who are still fertile and interested in maintaining their fertility, it's important to find that sweet spot. A healthy balance of sexual activity combined with proper nutrition and lifestyle changes can keep sperm production optimal. Regular ejaculation, when done moderately, doesn't seem to hurt sperm quality and might even have some positive effects. This is a great time to talk about some of the lifestyle factors that can complement this process, like nutrition, exercise, and stress management. Have you been focusing on your health outside of the bedroom? When we talk about ejaculation and sexual health in men over 50, it's not just about what happens during the act. It's also about the bigger picture. How does sexual health fit into overall well-being, and why should men care about maintaining an active sex life as they age? Let's break it down. Mental health benefits. Sexual health is intricately linked to mental well-being, and as men age, mental health can become even more important than ever. Many studies have shown that men who maintain an active sex life in their later years tend to experience less stress, anxiety, and depression. The release of endorphins during ejaculation triggers feelings of happiness and contentment, promoting a positive mood. In fact, regular sexual activity has been shown to reduce cortisol, the stress hormone that can take a toll on your mental health. For men over 50, dealing with changes like reduced energy levels, more responsibility, and sometimes even lifestyle stressors, staying sexually active can serve as an important release. It provides a sense of connection, whether with a partner or with yourself, that can help balance out the stresses that come with aging. Physical health and longevity. But it doesn't stop there. Research suggests that regular sexual activity, including ejaculation, could have a profound effect on cardiovascular health and overall longevity. Sexual activity stimulates the heart, increases circulation, and promotes the release of key hormones that help keep the body functioning optimally. In fact, some studies suggest that men who remain sexually active later in life have a lower risk of cardiovascular disease and may even live longer. It's not just about ejaculation. Regular intimacy is tied to better immune function, increased blood flow, and higher levels of energy. When we think of sexual health after 50, we often only focus on performance in the bedroom. But there's much more to it. Sexual health is intertwined with how your body responds to stress, how well you recover from physical exertion, and how your heart and other vital organs function. Oh, you're probably wondering, how do you ensure you're setting yourself up for success in this area? Well, it's all about a holistic approach to health. Just like regular exercise and a balanced diet contribute to physical health, keeping your sexual health in check requires the same level of commitment. Nutrition for sexual health. To maximize your sexual health, make sure you're fueling your body with the right nutrients. Foods rich in zinc, vitamin D, and antioxidants can all improve sperm quality and testosterone production. For example, foods like oysters, nuts, eggs, and leafy greens are essential for keeping your reproductive system in top shape. Not only do they support hormonal balance, but they also improve blood circulation, which is vital for sexual performance. Exercise for blood flow. We all know exercise is important, but did you know that it plays a significant role in sexual health as well? Regular physical activity improves blood circulation throughout the body, including to the genitals. This helps maintain erection quality and ensures that you're getting the best results in the bedroom. For men over 50, strength training, cardiovascular exercise, and core workouts are especially important for maintaining testosterone levels, building muscle mass, and improving circulation. Aerobic exercises like running, swimming, or even brisk walking can have a huge impact on maintaining healthy sexual function. But don't forget about stretching and flexibility exercises, which can improve overall energy and mobility. A well-rounded workout regimen is essential for a healthy body, and it translates directly into better sexual performance. Sleep and stress management. If you're not getting quality sleep, your hormones can become out of balance, and your body won't have the time it needs to recover fully. Poor sleep, combined with chronic stress, can negatively affect testosterone levels and leave you feeling sluggish. A good night's sleep ensures that your body stays energized, your testosterone levels are optimized, and your mood stays upbeat. This will, of course, contribute to better performance in the bedroom. Stress management. Stress can have a huge negative impact on sexual health. Prolonged stress leads to the release of cortisol, which can lower testosterone and leave you feeling fatigued. Managing stress is key, so consider implementing relaxation techniques like meditation, yoga, deep breathing, or journaling into your daily routine. By reducing stress, you ensure your hormones stay in balance and your body is ready to perform when needed. Engagement booster. At this point, let's hear from you. Have you noticed any changes in your energy levels or sexual health after turning 50? Drop a comment below and share your experiences with the community. Don't forget to hit that like button if you're finding these tips helpful. Let's keep the conversation going. As we've already seen, there are plenty of benefits to regular ejaculation, particularly when it comes to mental health, testosterone levels, and even cardiovascular function. But just like with anything in life, there's always a balance to strike. Ejaculating every day might be good for some men, but it's not always the best approach for everyone, especially as you age. Let's explore the potential risks and considerations that come with this routine, particularly for men over 50. The risk of overdoing it. First and foremost, there's the risk of overdoing it. We've talked about the temporary spike in testosterone levels and how ejaculation might even improve mood and mental clarity in some cases. However, ejaculating too frequently can lead to diminishing returns, where your body doesn't have enough time to replenish the resources it needs, including sperm and energy levels. While a daily release might work for some men, others may find that it leaves them feeling more tired, stressed, or physically drained. And remember, older age means your body doesn't recover from certain physical acts the way it used to. For some men over 50, daily ejaculation can become counterproductive, leading to excessive fatigue, irritability, and even a drop in libido. These are signals from your body telling you that it's time to give yourself a break and allow recovery. Another risk to consider is prostate health. The prostate is a gland that plays a critical role in sexual health, and it can become more susceptible to issues as men age. While moderate ejaculation is thought to be beneficial for prostate health, excessive sexual activity or constant ejaculation could possibly contribute to prostate irritation or enlargement. It's important to note that there's still ongoing research in this area, and no definitive conclusions have been drawn. However, some studies have suggested that frequent ejaculation could irritate the prostate, potentially exacerbating pre-existing conditions like benign prostatic hyperplasia, BPH, or prostatitis. For men who are already dealing with these conditions, moderation in sexual activity and ejaculation is key. Listen to your body, and if you experience any discomfort, pelvic pain, or frequent urination, it's always a good idea to check in with your healthcare provider. As we've already discussed, ejaculation is linked to a release of certain hormones, such as dopamine and oxytocin. While these feel-good chemicals are great for mental health in moderation, there's a potential emotional downside to daily ejaculation. Men who ejaculate excessively may find that it affects their mental state, leading to feelings of guilt, shame, or even anxiety. This can be especially true for men who associate their sexual health with their masculinity or self-worth. The psychological toll of thinking that you need to perform every day to feel good about yourself can sometimes lead to feelings of pressure or emotional exhaustion. If you're constantly concerned about your sexual performance, it could have a negative impact on both your self-esteem and your overall mental health. This is why it's so important to approach sexual health with a balanced mindset. If you're feeling stressed or pressured, it might be a sign that your routine is more about quantity than quality. And as you age, learning to embrace a more relaxed approach to sex can be incredibly liberating. Now, the big takeaway here is that everyone's body is different. There's no one-size-fits-all rule for how often you should ejaculate after 50. Some men may thrive with daily ejaculation, feeling more energized and mentally sharp. Others might find that their bodies need more time to recover and that reducing the frequency improves their well-being. It's essential to listen to your body and adjust based on how you're feeling. If daily ejaculation is leaving you feeling drained or you're noticing changes in your mental clarity or sexual satisfaction, it might be time to scale back. Similarly, if you're finding that regular release helps with mood, energy, and sleep quality, then there's no harm in continuing that routine. As men age, their bodies can be more sensitive to changes in routine. So while self-experimentation is fine, always check in with your health. If you're noticing any uncomfortable symptoms or changes in your sexual health, it might be time to speak with a doctor or a urologist who can help guide you on the best approach for your unique situation. Quick pause. How are you doing so far? Are you finding these insights valuable? If so, drop a comment below and share what's been working for you in terms of your sexual health after 50. Don't forget to give us a thumbs up if you've learned something new. We've covered a lot today, so let's bring it all together. The main message here is that ejaculating every day after 50 isn't inherently harmful. In fact, it can offer some surprising health benefits. But just like with any aspect of health, balance is crucial. Here's a quick recap of what we've learned. 1. Testosterone and mental health boost. For many men, ejaculating regularly can offer a temporary spike in testosterone, which can lead to better mood, higher energy, and a feeling of well-being. While it won't dramatically change testosterone levels in the long term, the short-term benefits are real. Staying sexually active when done in moderation can help with mental clarity and reduce stress. 2. Sperm quality and prostate health. Frequent ejaculation can actually improve sperm quality in men over 50 by flushing out old sperm and stimulating the production of fresh sperm. It also appears to have a protective effect on prostate health when done in moderation. However, too much may cause irritation in the prostate, especially if there are pre-existing conditions like BPH or prostatitis. 3. Physical and cardiovascular health. Regular ejaculation can contribute to better cardiovascular health and improve circulation, which supports overall physical well-being. Sexual activity engages the heart, improves blood flow, and even helps maintain a healthy immune system. All of these benefits are essential as you age and work to maintain physical vitality. 4. The importance of moderation. While it can be tempting to aim for daily ejaculation, it's important to listen to your body. Overdoing it can lead to exhaustion, a drop in libido, and other health concerns like fatigue or irritability. So, finding that sweet spot between too little and too much is key. It's all about quality over quantity. 5. Holistic health. The best way to ensure long-term success in your sexual health is by adopting a holistic approach, eating nutrient-dense foods, exercising regularly, managing stress, and getting enough sleep. When you combine these habits with a healthy and balanced sexual routine, you're setting yourself up for sustained vitality and satisfaction. So what does all of this mean for you? Well, if you're over 50 and looking to improve your overall health, don't be afraid to stay sexually active. In fact, embracing a healthy sexual routine can have positive effects on your testosterone, mental health, and cardiovascular well-being. But as with everything, moderation is the key. And don't forget, regular health checkups are important, especially if you're experiencing any unusual symptoms or have concerns about your prostate or sexual health. Your urologist can provide guidance on what's best for you. And there you have it, guys. Everything you need to know about ejaculating every day after 50. It's a topic that doesn't get talked about enough, but it's crucial for men's health, especially as we get older. If this video helped you gain a better understanding of how sexual activity impacts health after 50, don't forget to hit that like button and subscribe to the channel. We're always here with the latest insights on men's health and well-being. And make sure to share this video with any friends or family who might benefit from it, because the more we talk about men's health, the better. Also, if you have any questions or want to share your experience with daily ejaculation, drop a comment below. We'd love to hear from you. Remember to stay active, stay healthy, and always take care of your body, because age is just a number and the best is yet to come. And with that, check out our next video on boosting your energy after 50. You won't want to miss it. See you in the next one.